Hi everyone. So today we'll be doing a demonstration on blood pressure and we'll be describing it as well as perceived exertion. Blood pressure is defined as cardiac output times peripheral resistance. The cardiac output is provided obviously by the heart when the blood is ejected out of the left ventricle into systemic circulation, and peripheral resistance is provided by the vessels, the muscular layer of the vessels. Now there are various factors that can affect your blood pressure, such as blood volume, anxiety, and stress. What we're actually measuring is a ventricular contraction and a ventricular relaxation, so your systolic and diastolic respectively. A normal blood pressure reading has values that are below 120 for your systolic pressure and 80 for your diastolic pressure. Once those numbers start to increase, then we get into the danger zones of having elevated blood pressure and then going into a hypertensive stage 1 and 2 or a hypertensive crisis, which is going to require immediate medical attention. Now that we know what blood pressure is, let's describe what we use in order to be able to measure it. So there are automatic machines that can do this for us as well, but this manual method is going to utilize a blood pressure cuff along with the stethoscope. Now, first and foremost, you want to make sure that your patient is sitting down, the arm is placed horizontally at the heart level, and make sure that they maintain their legs uncrossed and flat on the floor. Now, obviously, this is if the conditions and the patient's health allow to do so. You can take this supine, and there's also an indirect method to taking blood pressure where they insert a catheter straight into an artery. Now, typically using the blood pressure cuff, we're going to go around on the left arm on the brachial artery, and we're going to put the stethoscope in the cubital fossa. Here we have a diagram with all of the steps that I mentioned earlier. So this is going to continue once you attach the blood pressure cuff. You're going to inflate it to about 20 to 30 millimeters of mercury on the baseline of the patient. And then you're going to proceed to take your reading. All right, hello everybody. So we're here with Kelly, and she's going to be the patient for today. So we're going to be taking our blood pressure with our blood pressure cuff and our stethoscope. Okay. Now, there are various ways to do this. There's a two-step method in which you will initially take the blood pressure kind of like in a blind way because you don't know the patient's baseline. However, you can also ask the patient if they know their baseline blood pressure. Kelly, do you know your baseline blood pressure?
Dude, it's 120 over 78 to 80.
All right, awesome. Right, very normal. So, with our blood pressure cuff, what we want to do is there are some markings on there. This is an adult cuff, so they are sized differently, okay? Now, as you can see, there's also an indication of where to place the cuff. Now, remember, we're looking for our brachial artery, all right? So, we're going to notice that we are going to place the cuff right here, where it says our right arm. So, there we go. We line it up properly, okay? And we make sure that it's not too tight, where there can be at least 2 fingers. Now, you want to make sure that your patient is relaxed. Her foot are flat on the floor, uncrossed, okay? Now, you can set your device on the pressure cuff over here, so that way you have your reading, okay? Now, you want to always make sure that you've sterilized your stethoscope, okay? And you're going to place it right over that brachial artery or the cubital fossa. All right. And then, because we know what her baseline pressure is, we can inflate till about 10 or 20 millimeters of mercury above that, so that way we can properly hear the phase 1 Karkaroff sound. So, we make sure that it is closed, and we're going to go ahead and inflate to about 130, 140. And then we start to let the pressure drop slowly. And you let it decrease as you're releasing the air by 2 millimeters of mercury all the time. I got good news for you.
Yeah?
Your blood pressure has improved. I just measured it at 117/70.
Let's go.
All right, excellent. Thank you so much for joining us today. And that is how you measure your blood pressure. Lastly, we have perceived exertion, which is a subjective measure to determine how much work is being performed or done by our patient. Now, there are various factors that are going to determine this rate of perceived exertion, such as the pace of breathing, heartbeat rate, muscle fatigue, and amount of sweat. All right, that's all. Thank you, guys.